Engendering transparency and accountability in the entire operations of the scheme is one out of the 3 points in the rebranding agenda of the present leadership of the NHIA. Stakeholders' engagement is one major way this can be achieved. Professor Nasir Mohammed Sambo has been applauded for using this strategy effectively to engender inclusiveness of stakeholders in ensuring that everyone is carried along in the attainment of universal health coverage. Still using this means, the authority recently organized a strategic engagement with state commissioners of health and CEOs of state social health insurance agencies to deepen their understanding on the new act and to bring them up to date on reforms going on. This meeting and the reaction of stakeholders to the new thinking make up a major part of our program as I welcome you to yet another episode of Easy Access to Healthcare for All, a program sponsored by the National Health Insurance Authority, NHIA. My name is Aisha Muhammad Ahmed, your regular anchor. Stay tuned for the full program starting after the break. Please don't go away.
I think I paid almost nothing.
We went easy. We only paid 10%.
We all work towards accelerating universal health coverage.
Everybody, irrespective of his gender, has access to basic healthcare services.
NHIA. We begin with the highlights of events around the NHIA.
The National Health Insurance Authority held a stakeholders engagement in Port Harcourt for desk officers of ministries, departments and agencies in the South-South. The forum was organized to keep their zone officers abreast of emerging developments within the health insurance ecosystem and to strengthen their capacities to serve NHIA enrollees within their agencies better. Dr. Jonathan Eke, who represented the Director General at the event, gave the opening remarks. While speaking, he said it is imperative to engage players in the field on happenings around the health insurance space.
What we are here today primarily is to see how we can reinforce knowledge and understanding of a scheme as it's been implemented currently, because we have not transmitted the new system. Two, we would only like to tell you about these things that are happening within the now National Health Insurance Authority, so that all of us will be carried along in the evolution of things.
The forum was engaging, discussing problems with solutions proposed, with stakeholders applauding NHIA for putting the program together. The National Health Insurance Authority has organized a one-day sensitization for its medicine supply initiative in Sokoto State, which is a pilot state for the initiative. The event had in attendance stakeholders in the health and pharmaceutical sector of the state. Pharmacist Al Hassan of the Standards and Quality Assurance Department gave a presentation on the initiative.
So the objectives of this initiative is to correct the rationale I talked about, is to facilitate availability of affordable, acceptable, accessible quality medicines and other health products. Is also to enhance the power of innovative financing and cost-sharing strategies to enhance access to medicines and other health products for diseases requiring catastrophic funding, eradicate out-of-stock syndrome within the national health insurance ecosystem, as well as change enrollees' perception on about the quality and efficacy of medicines dispensed under the health insurance schemes.
At the end of the presentation, stakeholders applauded NHIA for its continuous efforts to improve healthcare delivery to Nigerians. The NHIA Medicine Supply Initiative targets 3 core areas, including branding of drugs, cost sharing, as well as innovative financing in order to give drug security to enrollees.
Welcome back. The program is Easy Access to Healthcare for All, a program that brings you highlights of news and happenings around the National Health Insurance Authority. Healthcare delivery is a collective responsibility, and with the new act, states have become more critical in the implementation of health insurance and the attainment of universal health coverage. Little wonder then that the National Health Insurance Authority brought together state commissioners of health and CEOs of state social health insurance agencies together at a strategic meeting to deepen their understanding of the new act. Details of this meeting coming up in our next segment, issues around the NHIA. Please don't go away.
The NHIA Act 2022 gives the mandate of the authority as being to promote, regulate, and to integrate. To fulfill that mandate, the NHIA on Wednesday, 20th July, organized a strategic stakeholder engagement in Abuja for CEOs of state social health insurance agencies and commissioners of health of states. The objectives of the engagement include deepening the understanding of the NHIA Act, to make a well-articulated roadmap that will fast-track its implementation, to review the Act through a comparison of the content of the NHIA's Act with the NHIA Act, and to appreciate the implications of the Act on operations of the National Health Insurance Authority and its stakeholders. The strategic engagement commenced with an opening remarks by Professor Nasir Mohammed Sambo, DG, NHIA, who, while speaking, said an understanding of the law will reduce difficulty during implementation process.
When this law was signed at the level of the TMC, we sat down and developed a strategy to first of all ensure that every stakeholder in Nigeria has appreciated the ABCD of this law. Because if we don't appreciate the law, it will be very, very difficult for us to implement it the way it should. So that's why we embark on a series of stakeholders engagement. And today's meeting represents one of the most important stakeholders engagement that we are going to do. For the fact that the 83 million vulnerable segment of the population that will be covered under the law, under this law, will be driven at the state level. It is going to be driven through the mechanism of implementation of basic health care provision fund. Therefore, the role of commissioners and the role of state health insurance agencies is very, very critical in implementation of this law.
There were goodwill messages from the Nigerian Governors Forum, Forum of Commissioners of Health, as well as the Forum of State Social Health Insurance Agencies.
What are the components of the NHIA?
To set the ball rolling was a presentation titled Overview of the NHIA Act and a comparative analysis of the NHIA versus NHIA's Act. The role of SSHIAs at a glance by Blessing Nyenge, GM Legal Services, NHIA.
What are the components of the NHIA Act 2022? First of all, explicit enough to drive a process successfully. So we have 10 parts, 60 sections. The first part talks about the establishment of the NHI authority, the types of health insurance, Act 2004 Act. The first is that the name has changed. The name has changed from NHIS. Everybody has the interest of Nigerians at heart for the delivery of healthcare. And that is why the law too is strengthening this relationship by establishing schemes in our own law. Establishment of a scheme for coverage of employees of ministries, departments and agencies in the federal civil service, and other relevant groups. Implementation of basic healthcare provision fund in collaboration with states. In fact, we have just used 3, 2, 3, 4, 5 slides, but everything is around us and the states. So the message should sink to all of us that this burden or this responsibility is on our heads.
The roles of SSHIAs in the Act include establishment of state health insurance schemes, registration with the authority, establishment of ICT infrastructure for data management, participation in the Basic Healthcare Provision Fund, ETC. At the end of the presentation, stakeholders shared their thoughts on the new NHIA Act.
We must understand that there is no law that is 100% perfect. But what we have here, the first gift that we have received from this is the mandatoriness of social health insurance in Nigeria. That everybody now must come on board. Now this to the shares, of course, for us at the shares level, the state level, most of us have laws that have made it mandatory, except for 2 or 3 other states. Now for those states that have not, laws that are mandatory, that have made health insurance mandatory for their residents, this is a leverage. They can leverage this law to ensure that they get all their, or they review their own laws to ensure that there's mandatoriness, because without that, there can be no enforcement. And then, of course, without it, we know what had happened with NHIS for how many years? 15, 17 years of operations. What was the coverage rate? So except you mandate it, people aren't going to come on board. So this is a very good development, that we now have a law that mandates it, so people would have to come on board.
Well, it's certainly an improvement on the 1999 Act. There are a good number of elements in it that would allow us to move faster, very rapidly, particularly around how the Basic Healthcare Provision Fund should be implemented and ensuring that we capture the vulnerable and providing a social floor or social minimum floor for all Nigerians. So I think that's a great thing to do. The second thing it does is that it strengthens the capacity, right, of the NHIA to be able to play its role as a regulator, but also as a provider of oversight, right, within the system.
Professor Nasir Sambo also gave a presentation on the NHIA Act 2022 Strategic Roadmap for Implementation. It borders on operational modalities put in place by the authority for the implementation of the NHIA Act.
The whole essence of health insurance is cross-subsidization. How can a rich support a poor? How can a healthy person support a sick person? How can young people who are rich and they are not susceptible to healthcare challenges support people that are older and are more susceptible to healthcare challenges? How can a young man with one who is a bachelor and is working in Shell support somebody who is in state in the federal ministry with 4 children? That's the solidarity. That's the cross-subsidization. So it's not supposed to be made a profit treaty. It is all that health insurance requires is to maintain the liquidity to be able to provide the services. Health insurance success is not based on the profits that it is generating.
Another interesting presentation was on why Nigerians should patronize health insurance by Dr. Frank Ekuije.
For you to really get more determined and fired up to contribute better at the state level, to be able to ensure that this happens, working together with the NHIA. So the question is, how much do you actually think we need to spend on health to make it useful towards achieving universal health coverage? There are a lot of conventions, but the one that actually resonates more is, of course, Abuja Declaration, which was done on this soil, that every country will have to spend about not less than 15% of the government budget every year for health. But truly, we like the one of minimum of 5% of the GDP on health, because that shows how serious any country is in terms of investment in health.
Other activities at the engagement include a presentation on the overview of the National Social Register by World Bank, presentation on the Medicine Supply Initiative, presentation of draft communique, as well as discussions. For participants, the convergence was quite engaging as they made suggestions, contributions, and deliberated on issues that will move the health insurance space forward towards the attainment of universal health coverage.
The program is easy access to healthcare for all. Welcome to the Stakeholders segment. During the course of the strategic engagement session organized by the NHIA recently, we spoke to participants who are drivers of health insurance at different levels in their various states. They shared their thoughts with us on different issues. Some expressed their perception on the meeting.
Is basically creating a platform to harmonize the health insurance ecosystem in the country. We have a new law in place that has repealed the NHIS Act, and that law has made it mandatory for every resident in this country to participate in the health insurance scheme. The National Health Insurance Authority is bringing all the stakeholders at the subnational level so we can be in the same line towards achieving universal health coverage in Nigeria. And in my opinion, we are making concerted effort to make sure no one is left behind.
Initially with the shares, we're kind of afraid that it's like National Health Authority is about to take everything from us, the authority to regulate, to do everything. And then we're wondering, then what are we going to be doing in our different states? So this stakeholders meeting just made us understand that we still have authority in our state, and all we are doing is to collaborate, to join, efforts together, to make this the universal health coverage very successful in Nigeria. So we are now at home, we are happy, we understood everything. You're not coming to take over, you're coming to work together with us. So we are happy that this is happening, and we appreciate Professor Sambo for his leadership.
Some say the act is coming at a good time and will hasten the attainment of universal health coverage.
This is a new beginning, that comes with a lot of, opportunities within the health sector. Most especially the fact that someone somewhere is identifying the fact that we have people that cannot afford to pay for their health needs in Nigeria. And under the new scheme, the Vulnerable Group Fund has been clearly spelled out there to say that, look, we need to begin to find ways to address the challenges of those people who cannot pay for their health. So it's important. But beyond that also, the new law also stresses on the relationship between the NHIA as well as the state health insurance schemes. And I think that is also a point of note, a point of importance.
For others, they agree that the engagement is timely and will help in the implementation of the new act towards universal health coverage.
Actually, for me, I would say it is long overdue because for the entire world, the journey to universal health coverage can only be attained by the time we're able to sort out the problem of catastrophic health expenditure.
With what you see going on in the hall, you see everybody voicing what they think are ways forward. How do we cross our T's and dot our I's so that at the point of implementation, we will all be on the same page? I can tell you that in the last 2 days, a lot of ideas have been incubated in that room that will make sure that when we eventually roll out within the next couple of months, working with the new act that has made health insurance mandatory in the country, both drug supply, both issues around how are we going to get the funding, all of that will be seamless.
On the significance of bringing both CEOs of states, social health insurance agencies, and state commissioners of health together, some of them had this to say.
We have to appreciate the NHIA for bringing the shares alongside our commissioners, because our commissioners are the ones that write memos, that take everything for deliberation to the state executive councils. So it's good for them to hear from the NHIA what is in store as far as this new law is concerned. Not us, now the burden is not on us to go back and translate all this that has been discussed today.
That's it on our Stakeholder segment. Next on the program is your questions answered. Please stay tuned.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Question. Enrollees are often told NHIA drugs are always unavailable. Why?
Our payment mechanism. We pay the healthcare facilities by 2 systems. The first one, at primary level of care, we pay by what we call capitation. Capitation means that NHIS has paid the healthcare facility ahead for the patient to go there and access services and also be able to be dispensed drugs that are prescribed by the prescriber. The second one is fee for service, which means the hospitals give out these services and drugs or products and then come over to NHIS to be reimbursed. So the truth is that no patient should go to the hospital and not have his prescribed drugs dispensed to him. And when that happens, we have the appropriate channels. There are the state offices, we have the call center of NHIS that can easily be reached for us to intervene, and also the HMOs. The particular HMO of the enrollee should be notified. We are putting a lot of structures in place. We are trying to do surveys now through our state offices to know the level of hospitals complying with these guidelines to ensure that all enrollees of NHIs receive the appropriate and prescribed drugs.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
This is where we draw the curtains on this episode of the program. Join us again, same time, same station, on another episode as we continue to bring you more stories of happenings around the NHIA. Enjoy the rest of your day.